Is Stroke Awareness Month, and when it comes to strokes, every minute matters.
Yeah, Dr. Karen Olds, neurologist and stroke medical director at St. Luke's Marion Blanc Neuroscience Institute, joins us to break down the warning signs, the different types of stroke, and what new treatments are helping patients recover. Dr. Olds, great to talk with you.
Thank you for having me.
Yes. All right. With strokes impacting so many people, are there any new treatments for the strokes or the after effects of a stroke?
Yeah, St. Luke's has a new program as of the end of last summer, and it's called VivaStim, and this is something that can help folks that are 6 months to 10 years out from a stroke. To qualify, occupational therapy helps us determine a Fugl-Meyer score and how much disability there is from an upper limb, so from an arm. And this is a device, it's a vagal nerve stimulator that's been used in epilepsy neurology for a long time. So it's implanted under the skin. And initially, once the patient is implanted, heals up for a few days. We have intensive therapy, about 90 minutes, 3 times a week for 6 weeks. It's FDA approved to help recover upper limb function after an ischemic stroke.
There are 3 different types of strokes, and many may not know the difference. Would you explain the different types to our audience?
Yeah, so over 80% of strokes are ischemic strokes. So that's where a part of the brain's not getting good blood flow. It can be a small vessel stroke, or it can be a large vessel stroke where there's a clot or a piece of plaque blocking that. So that's kind of our ischemic stroke. Hemorrhagic strokes are about 20% of strokes, and those can either be a subarachnoid hemorrhage from an aneurysm or an irregularity, a weakness in the wall of the blood vessel bursts and blood floods into the subarachnoid space, or an interparenchymal or intracranial hemorrhage, where maybe a vessel deep in the brain, usually with high blood pressure, will burst and cause blood in the brain tissue.
Now, you did touch on it a little bit, but why is it so important to seek care immediately?
We can give a thrombolytic, a clot-busting drug, within the first 3 hours of a stroke, sometimes up to 4.5 hours. And then St. Luke's did start what we call our wake-up or unknown time last known well protocol. So in some situations, we can do a very fast MRI scan and comparing a couple of the different sequences. Usually with somebody who wakes up with stroke symptoms, we can sometimes give that thrombolytic without knowing exactly when the person's symptoms first started.
And we talk about this every year, but it is so important to revisit. What are the warning signs of a stroke?
Well, I think the best way to remember it is using the acronym BFAST. So strokes usually start very suddenly. So a sudden onset of balance, maybe a room-spinning vertigo type sensation. The E stands for eyes, so it can be a sudden onset of double vision or a loss of vision. And then the FAST acronym stands for face, so weakness of one side of the face. You can have the patient or the person smile and see if they have a facial droop. Arm weakness, you have them hold up their arms, and if one arm drifts down or if they can't raise it at all. Strokes can affect speech and language, so a sudden onset of slurred speech, or what we call aphasia. So that could be can't get the words out. You know what you want to say, but they don't come out. The T is for time. We don't want any extra time to pass. Seek help immediately.
It's a really good way to remember all of that. Now, 80% of strokes are preventable. So what are some ways that people can lower their risk of a stroke?
Well, first and foremost, you need to make sure that you're having regular checkups with your physician or your nurse practitioner. Make sure your blood pressure is well controlled. For most adults under the age of 80, we like a blood pressure less than 130 over 80. Cholesterol checks are important. We want the total cholesterol to be less than 200. The bad cholesterol, called the LDL, we would like that to be less than 120. Knowing your risk if you have diabetes and keeping that blood sugar under good control. Of course, eating healthy and exercising, trying to maintain a healthy weight. Those are all things that we can do to prevent strokes.
Well, Dr. Olds, thank you so much for giving us all these tips. Is there a resource or a place that people can go to get more information about this?
Yes, American Heart Association, American Stroke Association, but also the St. Luke's Neurology website has this information on it as well.